My name is Monique, for those who I have not met before. Those are all you know me. What's up? um, at first, I wasn't going to speak because I suffer from social anxiety. And so, y'all looking at me is making me nervous right now. And I I chose to do this because I've come to terms with what has happened to me and I'm ready to share my story. But when I was asked to share, I was scared. And then it got me thinking, like, you chose to be here. You chose to be in this profession. Like, this is the time to get out of your shell. So here I am. I mean, I have a long history with undiagnosed mental health and then diagnosed mental health. I was born and raised in Jamaica, so in Jamaica, if you present any kind of mental situation, you're labeled as crazy. People go as far as throw acid in your face, especially if you're a part of like the LGBTQI plus community. Even now, my family, they call me crazy and stuff, talk about go back to the crazy house and stuff. So talking about mental health in the Black community is very hard to do. And after my mom passed, my mental health got really, really bad. Like, I was in a bad place. I was left on my own. I felt like I wasn't wanted, like I wasn't needed in this world. I didn't have a purpose. You know, without having to take care of my mom, I was like, what am I here for? People don't realize mental health, it's mental. Even if you're surrounded by people who love you, if you tell yourself that you're not worthy, you feel that to your core. And even though my friends were there for me sometimes, I tell myself that I wasn't needed on this earth. I have no purpose. And so I said it was time to go. In the span of 1 year, last year, I was diagnosed with diabetes. I was told that I have a tumor. I was paralyzed in both legs, told I was gonna walk again. The doctors gave up on me. I was in the hospital for 1 whole year. They let me go because they didn't know what to do with me. I came to New York. I was sent here. My family told me I wasn't wanted. It was just a really dark place. I ended up in the hospital, and at my darkest place, at the place I never wanted to be, I found hope. I found people, strangers, telling me how much of a bright light I was to them just by being here. The fact that I'd gone through what I'd gone through and was still here, you know, was a testament. And of course I didn't believe that because I was still in my own thing, you know. But as I was there, talking to people, being surrounded with like-minded people, being surrounded with people that got it, I was like, I'm not alone. This is not just me. Like, there are people out there who have similar situations to me, whose voices aren't being heard. And, you know, stuff started happening around me where people were being mistreated, even in the hospital, that I just couldn't stand for, you know? And it was like the same thing that happened to me. Like, doctors, there's a stereotype. I have sickle cell. There's a stereotype with sickle cell that we're like, we go to the hospital for pills and stuff like that. We're addicts. And so I've been turned away from hospitals when I'm in a crisis because they think I'm there for medication. And I was seeing that happening, and that has happened to me. And so I started, you know, talking up for people. Like, you can't, no one knows themselves better than themselves. You can't tell me that I'm not in pain. You can't tell me what I'm feeling is not real. And so, you know, I started standing up for people, and then A doctor came to me and had a conversation. No one had asked me while I was in the hospital, but he came and he asked me some questions. And those questions, they left a mark. Like no one had ever asked me questions like those before. Like when they follow the medical model, so they are just, cut and dry. But he asked me questions and I was ready to explain my story. And it's like, well, what changed now? What's different now? Why are you not going to do what you did the last time now? And those were the questions that made me think. I have support now. I can see the people around me now. I realize that I'm not alone. Like, there are other people like me out there. And they told me about Howie the Harp, and I looked into it, and I was just so touched by the work that they do. And I was even talking to my peers, and this is a generation that is breaking generational curses. We are the generation that are learning to change the stigma. We are the generation that is working to make a difference, because our grandparents and stuff, they probably suffer from it, but they don't believe in it. And the buck stops here. It ends with us here. We are the ones that are going to make sure that the future generation feels loved, feels wanted, and know that they can talk about things. And that's what I want to be a part of. That's what Howie the Harp has taught me, that the change that they want to make, and that's what I want to be a part of. Thank you.